I wanted to go over what sickle cell disease is today. I'm also going to just do this very simple explanation. It can get really complicated, especially when you talk about why these cells sickle or turn to a different shape. Where did all this come from? And why does it have to do with mosquitoes and malaria? Sickle cell disease or sickle cell anemia is an inherited red blood cell disorder. It was inherited. This is something that is a genetic thing. This is not something that is contagious. It's not something that people get who are poor. Anybody can get it. It's prevalent in 3 countries, 3 areas of the world, and I'm going to tell you those in just a moment. How is sickle cell disease diagnosed? Sickle cell disease is diagnosed, at least in the United States, all babies at birth get a panel of where the heel stick is done and the blood is taken from a heel stick onto a card or cards, and that blood is tested for different disorders. And sickle cell is one of them, at least here in the United States, every single baby born. Now, can parents refuse that? Yes, they can refuse to have blood work done and have disorders and illnesses ruled out. They can say they don't want that done to their child, at least for the time being, although I would encourage that they get it done at some point. These are things that you want to learn about. The earlier, the better in that child's life. But why would you want to not know? You want to know if your child has some other disorders, but for sure if they have sickle cell disease. What is sickle cell trait? One normal gene and one sickle gene have occurred together into that child. One normal gene, one sickle gene. And then sickle cell disease is when both of those sickle cell genes have occurred by these parents, and then that child would have sickle cell disease. This is nothing to feel guilty about or ashamed about. This is just what happens in the world. This is how we find out about diseases and where they're coming from. Remember, even cancer has a genetic change to it, a genetic component that we can't always help or prevent. Okay, the sooner the child can get diagnosed with sickle cell trait or sickle cell disease, the better. Lab work by a blood draw or heel stick if it's a baby, and something called hemoglobin electrophoresis is also something that is done. Hemoglobin test in the regular blood panel is going to be looked at and then tested further. So in a nutshell, what happens is these normally red, smooth, round red blood cells are flowing along nicely. And people with sickle cell disease have a disorder that causes them to have some of their red blood cells change shape into this crescent shape or sickle shape. The problem with that is that those shapes cannot get through smoothly as the round ones can. And so they have a tendency to clump up in the vessels. Clumping up in the vessels causes a lot of problems because the red blood cell carries hemoglobin, and that's the oxygen throughout our body. So that's where the anemia comes in, or the lower oxygenation to the body. But what happens when these cells clump up is intense pain. It's extremely painful for people to have this. And when they have something called a sickle cell crisis, they are almost always hospitalized and treated as if it is an emergency, because it is an emergency. Sickle cell crisis, besides causing immense pain to the person, it can also cause stroke. They're at higher risk for stroke, and they're at high risk for something called acute chest syndrome. People can die from this who have sickle cell disease. So it needs to be believed and it needs to be treated in an urgent, emergent manner. What are the symptoms when a person is experiencing sickle cell crisis? They have, like I mentioned, pain, but where is the pain? The pain and swelling can be in hands and feet and legs, like in babies or children. It can be anywhere in the body, because as we have these vessels and the red blood cells and these crescent-shaped cells are trying to distribute oxygen throughout our body, and they're clumping in certain areas. It could be hips, abdomen, chest, anywhere in the body. When acute chest syndrome is occurring with a patient, again, this is an emergency. Patients need to be in the ICU. They need to be treated appropriately and And we need to believe what they're saying. This just isn't discomfort in their chest. Their oxygenation will be low. It will show up in their blood work, in their hemoglobin. They need oxygen. They need pain medication. Whether it's acute chest syndrome where they can die, if anybody's in sickle cell crisis or having a pain-associated problem occurring with their sickle cell disease, narcotics are something that is frequently given. They need that higher level of pain management, the higher the pain is. So if somebody's just experiencing maybe mild pain, they're maybe going to treat with anti-steroidal medications like Advil, for example, or Tylenol, or topicals, or heat. Heat seems to help a lot of people too. But as things may or may not progress, the pain needs to be treated appropriately. You're treating the symptom of intense pain. So if the pain is an 8 or 10 over 10, then you're going to treat it appropriately. Why am I saying all this? Okay, I'm saying all this because as a healthcare person, if pain is the 5th vital sign. So if we take a temperature and the temperature is 102, do we argue with the patient that their temperature is not 102? No. If we take their blood pressure and it's 90 over 40, or in my case, after my total hip replacement, 84 over 44, we're going to believe that person. This is their vital sign. All right, I know, I hear you. Sometimes it's hard to take pain seriously with some patients who might be on the phone or uploading something on TikTok and then they say their pain's a 10 over 10. I'm not talking about that. So patients who have sickle cell pain are going to describe it as extreme, and we need to believe them. When I worked pediatrics, we had babies all the way up to adolescents. And we had lots of kids that were regulars that came in for their sickle cell disease. And so we watched those kids as youngsters and then grow up into being teenagers and into their 20s, early 20s. Yes, people in their 18, 19, 20 can still go to a pediatric or adolescent floor. It just depends on what the illness is, like sickle cell disease or cystic fibrosis or something. If you see somebody who's in sickle cell crisis, you know. It's like somebody in labor giving birth. You know. There's no denying it. This person is in pain. So that's why I'm talking about pain as the 5th vital sign and as something that we need to take seriously. We need to believe patients and treat them accordingly. Let's go over a few myths. All right, I briefly touched on this, I think, at the very beginning. Sickle cell disease is not contagious. This is an inherited disease. It is not something that you outgrow. This is a lifelong disease management process for these patients, for these people. Sickle cell trait cannot change into sickle cell disease. The trait that somebody has, it's rare, but it can happen, where in extreme situations, maybe illness, dehydration, weather changes, extreme. I'm talking about if something's going on with that person, they have sickle cell trait. That doesn't mean they can't have a pain crisis, but their sickle cell trait won't turn into sickle cell disease. Another myth that people talk about is that sickle cell disease can skip a generation. That's not true. And other people also say that nobody can get sickle cell disease unless they are of African American descent. That's not true either. Where are the top 3 places that sickle cell disease is most prevalent in the world? Number 1, Nigeria. Number 2, India. Number 3, Democratic Republic of the Congo, or DRC. Those are the 3 areas that sickle cell disease is most prevalent. I'm just going to briefly go over some of the treatment. This can be different and change depending on the person, depending on the severity of their illness or their crisis at that time, depending on the hospital's protocol, and so forth. But in general, at least what I always saw, and what I'm continuing to read up on, is that treatment management continues to be pain management, PCA pump, narcotics immediately, not in an hour or 2. IV fluids, oxygen, anti-inflammatory medications. If it's helpful, topicals. If it's helpful, heat. Remember, the crisis or pain crisis, intense pain in a certain area of the body, is because of that clumping together in the vessels of the round, normal, smooth red blood cells together with the crescent-shaped sickle red blood cells that have turned into that. A pain crisis can last hours or weeks or even months for some patients. Sometimes patients need blood transfusion. Some patients can go on and in their medical center can be offered a stem cell transplant, bone marrow transplant, blood transplant. And the medication hydroxyurea is something that is given to patients not when they're in acute emergent situation of a pain crisis, but on a daily basis at home, or however it is prescribed by their provider. And that medication is intended to help them have less pain crisis scenarios and less intense. I want to talk for just a moment about if you're a school nurse, or if you have a child or adolescent, or even somebody in college that's going to school. That person can still get an IEP, individual education plan. An IEP is something that your child needs, and needs not that they have to have it, but they would benefit from having it because it protects them. So an individual education plan helps you and the school nurse or the medical provider at the college put together a plan ahead of school, say in the summer, and it starts with doctor's orders. You come in and meet with the school nurse or the medical provider and explain, my child has this, and the education has got to be given to the teachers. Not all teachers know about this, just like I don't know a lot of things about teaching and about education and about testing and what is required. So I don't hold anything against them. They need some education in this. So when I would do a treatment plan for a child, for example, who was in school, it said, this is what the symptoms are going to look like. Even for the little kids, if they come to you and feel bad, I don't feel right, I have a lot of fatigue. They have fatigue because they have anemia, chronic anemia. My back hurts, I'm in pain. Send them to the nurse's office. Now, if you're in a private school or some other scenario where you don't have a nurse or LPN, an RN or LPN at that school, then all you can do is educate the teachers on when to call you. Call the parent, the grandparent, and so forth immediately. This is not something where the child can tell the teacher, I don't feel well, or I have pain somewhere, or the child has a low-grade fever, and then nobody calls anybody, nobody does anything, just go lay down for a while. That's not the situation. The parent or family member has to be notified, and the child has to be given appropriate treatment as soon as possible. What about a cure? There's no cure at this time where everybody's going to get over there and get their cure. It's that some other things have finally, thankfully, come down to be offered to these individuals to partake in. Now, not everybody has access to this. This is very, very expensive therapy, one of them being CRISPR. CRISPR is something used also for cancer patients and other things, cystic fibrosis, sickle cell disease. And it's a gene editing, permanent gene editing procedure that is done that takes about a year and is very expensive. This is new, or fairly new, within the last couple of years, but it is considered something that could possibly offer a cure to patients. Another thing I mentioned as something that's possibly curative would be the bone marrow transplant or stem cell transplant. So we've got CRISPR, the gene editing tool, and then the transplants that I mentioned. That's what's out there at this time. What are these individuals wanting us to hear? They want us to hear that, number one, their pain is real. This misconception of the pain not being as bad as it is or not being treated as an emergency is a myth. That's wrong. Their pain is real. Number two would be trust them. So that goes back to whatever they say they're feeling. If it's a child, if it's a teenager, if it's an adult, if they say my back is really hurting, or I feel like I'm coming down with the flu, something doesn't feel right, my pain is progressing, I can't manage it at home, then they need to come in. They need to come to the ER. They need to be seen. Their pain is real. Trust them. And thirdly, like I've already mentioned, this needs to be treated like an emergency because it is an emergency. When I was a nurse in the hospital and these patients would come in, if you saw them, you would understand. I think sometimes people have to just get educated and then get their eyes on somebody who really has one of these illnesses that go on for them, not just sickle cell, but sometimes it's hard for people to understand or believe certain diseases unless they see it for themselves. Not saying it's right or wrong, just saying that they don't understand it. So education really is critical. It's everybody's responsibility then to listen to these patients and treat them appropriately. So again, the three areas that are most prevalent in the world are Nigeria, India, and the DRC. In specific areas more than others, say of India, but It's really a complicated thing, to be honest. Not that you can't understand it, but I have to really, really think about it when I try to understand how it is about the genetics of this and why those places, Nigeria, India, and DRC, well, it has to do with that, has been the highest amount of mosquitoes, therefore malaria. But what does that have to do with sickle cell disease? Well, it has something to do with the fact that if somebody has sickle cell trait, that sickling or sickle cell disease, that sickling of that cell changes the way malaria affects their body. So people with sickle cell trait almost have a bit of protection from malaria. It then changed into sickle cell disease, and they don't have so much protection anymore from malaria. That's just a lot. There's just a lot to go over just in that little bit there. And I'm no expert on any of this. I'm a registered nurse. I research everything that I tell you. I will list everything below, as I always do. And I also talk to you about my experience with any patients or any scenarios, my experience working with patients who have some of these diseases or illnesses that I ever talk about. It comes from my own personal experience as a registered nurse taking care of them. I'm talking about what I've seen over 25 years of working with patients who have sickle cell disease, and just passing some of that information on to you. So if there's just a couple things I could pass on to you, it would be the pain is real. Sickle cell crisis is an emergency, and trust the person who's telling you, because they know best. They've been living with this their entire lives. It does not go away. If you like anything that's related to medicine, medical topics, medical mishaps, myths and facts about medicine, personal stories, then I invite you to consider subscribing. Have a great day.